Hi there. Thank you so much for checking us out here on our YouTube channel today for your medication needs and other medication related questions that you have. And as a way to support our community here at DamiRx Care, we do recommend you subscribing to our YouTube channel. Also, we would like to gift you for subscribing to our YouTube channel. And if you check the description bar below, you'll find a link where you can download a free diet meal that we do have here as you commence on your healthy lifestyle and habit. Hi there. So what is our medication of choice today? Our medication of choice today is Olanzapine. So Olanzapine is also known as brand name Zyprexa. So this medication is used for patients who have agitation, patients who have anorexia, or patients who have a bipolar disorder. This medication can also be used as an add-on for patients who are taking chemotherapy and are needing a medication to help with their nausea, as well as this medication can help with depression, schizophrenia, and delirium. So this medication ranges between 2.5 to about 20 milligram tablet. So depending on what the doctor is trying to treat, they may place you on a dose, which is the 2.5. It could be 5 milligram, it could be 15, it could be 20 milligrams. So it just kind of ranges between that 2.5 and 20 milligram tablet. So this medication does come in an intramuscular injection as well as an oral tablet and also an oral disintegrating tablet. So what are some of the side effects of this medication? So some of the side effects of this medication include weight gain. So this medication can increase patients' weight. It can also cause increased appetite as well as headache. It can cause constipation. It can cause dizziness, tiredness or fatigue, as well as abdominal pain. So what are some serious side effects that you definitely want to reach out to your doctor for immediately when you start noticing those symptoms? So some serious side effects of this medication include any changes in behavior or any unusual behavior or thoughts of like hurting others or yourself, or thoughts of suicide. You definitely want to make sure that you're reaching out to your doctor regarding that, to make sure that this is not relating to this medication, and just kind of help in terms of what route to go if you start noticing those symptoms or those thoughts. All right, so if you also start feeling any consistent fever, chills, or cough, sore throat, or body aches when you start taking this medication, make sure that you're reporting that to your doctor, as well as if you start noticing any abdominal jerky or muscle movements or any type of movement that you cannot really control, often in your face, your tongue, or your jaw, make sure that you're reporting that to your doctor. This is a class side effect because of the way those medication work. It can cause this abnormal movements in those patients. So when you start noticing that, make sure that you're reaching out to your doctor immediately. That way they can assess and evaluate if this medication is still going to be a preferred medication for your condition. Also, if you start noticing any lightheadedness, seizures, tremors, any sweating or confusion, uneven heartbeat, any muscle stiffness, make sure that you're reporting those to your doctor. Also, you definitely want to report to your doctor as well if you start noticing any swollen breast or you start noticing any form of liquid discharge from your nipples. It could be in men or women, so not just women. If you start noticing this, make sure that you're reporting to your doctor immediately. Also, if you start noticing any swollen or painful lymph nodes, maybe around your jaw area or maybe around your armpit or your groin area, make sure that you're reaching out to your doctor regarding those, as well as any trouble breathing or swallowing right after taking this medication. You definitely want to make sure that you're reaching out for those. If you also start noticing any unusual bleeding or bruising while taking this medication, make sure you're reporting. those to your doctor as well. Like I said, this doesn't always happen to everyone, but just in case, if you start noticing any of those symptoms that I mentioned, make sure that you're reaching out to your doctor and calling your doctor's attention to it. All right, so what are other things to know about this medication? So while you're on this medication, you want to make sure that you're staying well hydrated, as this medication may cause dehydration or kind of cause like overeating in the body. So making sure that you're staying hydrated, making sure that you're avoiding excessive sunlight, or making sure that you're, especially when you're exercising or doing any activity that requires high energy, make sure that you're staying hydrated if you are taking this medication at the moment. All right, so also in patients who are going to be operating any machinery, if you know that you're going to be driving and you just started taking this medication, you want to make sure that you understand the side effect or how well your body tolerates this medication before involving yourself in any activity that will require you to be mentally alert. That way you're not driving and you become dizzy all of a sudden or drowsy while you're driving. Also, with this medication, you want to make sure that you're avoiding alcohol while you're taking this medication. You may also feel some lightheadedness if you sit down. If you tend to sit down a lot for a long period of time and you try to get up all of a sudden, you might notice some lightheadedness. So you want to make sure that if you've been sitting down for a long period of time, that you're getting up slowly after doing that, or if you're trying to get back up. All right. Also, with this medication, you want to make sure that you're going to your doctor very often. That way they can do your regular checkup and making sure that you're not missing any of your appointment. That way they can continue to check your blood labs and making sure that everything is normal while you're taking this medication in terms of your blood sugar, your cholesterol, or your blood pressure, making sure that everything is okay. Also, they'll be able to help in terms of that abnormal movement that I mentioned earlier. It is called tardive dyskinesia. So it's an uncontrollable movement that may occur more often than normal in patients who are taking this medication. So when you start noticing that, make sure that you're bringing that up in one of your appointments. That way the doctor can evaluate and make sure that this medication is still the right choice for you. All right, I hope you were able to enjoy this video and learn one or two things regarding how well to take this medication safely and effectively while you treat this condition. Thank you for watching, and make sure you hit that like and subscribe button down below. That way you can help support our community here at Demi RX Care. Thank you and stay blessed.